Hi, I'm Paul Silovsky, physical therapist and owner of Rebound Physical Therapy, and I wanted to talk to you today about the subject of chronic pain. And I specifically want to get into some of the causes and remedies for these chronic pain conditions that folks experience. 1 out of 5 people in their lifetime will have a chronic pain condition, and that really can ruin the quality of their life. And we're not just talking about the pain, but the loss of function that goes with that. Pain, injury, or dis-ease, right? Dis-ease to the muscles, tendons, nerves, bones, ligaments, all of these things, trigger this chronic pain response with your nervous system, with your brain, and they let you know that you got a problem there, but you don't always know why it's there. So pain becomes chronic by definition after about 6 months. Now, I'm certainly not saying you should wait 6 months to get into that category, because you can do something about it before then. But when you're not dealing with a surgery or recent injury, or as a matter of fact, even if you are dealing with a surgery or recent injury, you should see improvement in that 6-month period with your pain and your function. But if it hangs on after 6 months and becomes chronic, man, there's something that you need to do about that, because the condition is there, it's not going away, and there's something you can do about it. So there's 2 types of chronic pain. Somatic pain, that's the soft tissues like your neck or your back, the muscles, the joints, the ligaments, the structural components that are giving you pain. It could be your hips, your knees, your ankles, your feet, the bottom of your feet. All those soft tissues can give you what's called somatic pain. Okay, the other type is the nervous system pain. Damage to the nerves from surgery, injury, illness. All of those things are a very distinct, different kind of pain. Now, you may not always be able to distinguish where it's coming from, but we can definitely help with that in our evaluation, along with working with your doctors with the testing that they do. So, but it's important to separate the two, because we can treat each one of those things a little bit differently. But let me give you an example, because handling chronic pain with only drugs or surgery isn't necessarily a long-term solution if you don't get to the causes. They may treat the symptoms, but they may not handle any deficiencies that you might have in your body. And here's the example I gave you. Let's say I have a repetitive motion injury from working manual labor type on the line. I'm bending to one side, rotating and bending to one side repetitively, and I acquire a degenerative disc. A disc that's narrowed, becomes a little arthritic, closed down. I've got both nerve pain and soft tissue pain from working over the years. Knowing that you have that condition, you have to do something about not just the motions that you've been doing, but balancing out, getting symmetry back in the body, because the degeneration isn't necessarily going to go away, but the soft tissues around the joint, the integrity of the nerve, all those things can be improved or enhanced so that you don't have as much pain, so the pain goes down and the function goes up. And if you're able to function better, stay strong, be more balanced, know what's causing your symptoms, what's making it worse, because a lot of times those pains, even though you have chronic pain over time, it can kind of go like this. It goes up and down over time. And sometimes it just keeps going a little bit up. It may drop and it goes even higher. Well, those are the times you need to see a PT, so that we can calm that thing down and get it into something that you can manage, where you're managing causes, where you have corrective actions that you can take to handle your pain, not make it chronic anymore, and get back to doing the things that you love. So if you're having chronic pain, let us help you out. We can help you live a better life. Get back to action. Give us a call, because you don't have to keep taking drugs and always doing surgery. We're here to get you out of that cycle and get you back to action.